Dietary considerations such as reducing the daily intake of caffeine and fatty foods can benefit individuals with IBS. Individuals with IBS are often aware that some foods exacerbate their symptoms. Thus, they can improve their symptoms by avoiding these foods. If one is not aware of a specific food trigger, a food diary can help to identify a contributor. But people who've had an eating disorder should approach dietary restrictions judiciously, as this could exacerbate their eating disorder. A low FODMAP diet is based on the hypothesis that poorly absorbed carbohydrate allows excess undigested carbohydrate to reach the lower gastrointestinal tract, or the large intestine, and here the undigested carbohydrate can stimulate the growth of microbes or be fermented, producing hydrogen gas, leading to bloating, flatulence, diarrhea, and constipation. Theoretically, the restriction of fermentable foodstuffs deprives the gut microbiota of their energy source, and it results in decreased symptoms. However, the long-term effects of a low FODMAP diet have not been well characterized, and beneficial microbiota, such as bifidobacteria, also rely on FODMAPs as a food source. Foods typically avoided on a low FODMAP diet are those that contain high levels of fructooligosaccharides, like wheat, rye, onions, garlic, and artichokes. Galacto-oligosaccharides, like legumes. Lactose, like milk. Fructose, like honey, apples, pears, watermelons, and mango. And sorbitols, like apples, pears, stone fruits, sugar-free mints and gums. And mannitol, like from mushrooms, cauliflower, and sugar-free mint and gums. A 2018 systemic review and meta-analysis supported the use of a low FODMAP diet for the treatment of IBS, finding that adhering to the diet was associated with a reduction in the global IBS symptoms compared to the controls, although the quality of evidence was considered to be low. In one study, subjects with IBS were assigned to a low FODMAP diet, and they experienced significant improvements in their symptom response, which was less bloating, abdominal pain, and flatulence, relative to the standard diet. These results are supported by a later study showing that people with IBS, guided to eat a low FODMAP diet, experienced a significant decrease in abdominal pain. Reintroduction of food as tolerated should be considered, as the long-term adherence to a low FODMAP diet has been shown to lead to unfavorable changes in the gut microbiome. In IBS patients who followed a low FODMAP diet for 3 months, it led to significant improvements in the symptom severity and the quality of life. This initial symptomatic improvement was maintained after the reintroduction of the challenging food, which was increasing the fiber intake for the next 3 months. While a gluten-free diet is required for people with celiac disease, there's wide spectrum of non-celiac gluten sensitivity symptoms that can be present in IBS. Gluten is found in grains, bread, pasta, etc. Similar to a gluten-free diet, a low FODMAP diet also restricts gluten, and both diets are used to manage food sensitivities, suggesting that gluten sensitivity might be a more common contributor to IBS symptoms than was previously thought. Following a gluten-free diet also reduces the dietary consumption of fructans, a FODMAP, which one small study pointed to as a possible leading cause of IBS symptoms rather than the gluten. In one double-blind, randomized, placebo-controlled study of IBS sufferers who specifically didn't have celiac disease, the addition of gluten worsened the abdominal pain, bloating, fatigue, stool consistency, and overall symptoms of IBS. However, as of mid-2021, only limited evidence supports the adherence to a gluten-free diet as a strategy for the treatment of IBS. Conventionally recognized food allergies are primarily mediated by types of immunoglobulin E antibodies. However, evidence suggests that food sensitivities, which primarily involve immunoglobulin G, can contribute to the intestinal inflammation, gastrointestinal disorders, as well as related conditions like depression. Although mainstream medicine typically dismisses this hypothesis, some evidence suggests testing for immunoglobulin G food-related antibodies can be useful for managing IBS symptoms. The idea is that food to which individuals produce high levels of immunoglobulin G antibodies should be avoided or limited. Some report a reduction in the IBS symptoms after eliminating the immunoglobulin G positive foods. In one randomized study, people with IBS were tested for immunoglobulin G antibodies against a variety of foods, including chicken, wheat, soybean, and rice. They were then assigned to the diet that excluded the foods to which they had the immunoglobulin G positive antibodies, or to sham diets that eliminated foods to which they were not immunoglobulin G positive. In almost every case, this resulted in a significant improvement, which was reversed when the troublesome food was then reintroduced. Similar findings were reported in a 2012 study. In this study, immunoglobulin E testing was important to exclude the food allergy, whereas immunoglobulin G testing was important to diagnose food sensitivity. In a study of individuals who followed a gluten-free diet, symptoms of IBS were improved in 75% of those who were positive for the anti-gliadin immunoglobulin G and immunoglobulin A antibodies, compared with only 38% of those without the antibodies. A study published in 2019 used confocal laser endomicroscopy to identify the non-immunoglobulin E food reaction in many of the IBS patients surveyed, further supporting that other mechanisms of food-related immune dysfunction might be at play. Bulking agents like dietary fiber and fiber supplements are frequently used to treat IBS. Dietary sources of fiber can include whole grains, oats, fruits, vegetables, beans, lentils, nuts and seeds. Psyllium husk powder is a common source of supplemental fiber. Insoluble fiber facilitates defecation by reducing transit time, while soluble fiber increases stool viscosity. A 2018 review and meta-analysis found that fiber improved the overall IBS symptoms. However, when broken down by fiber type, it was found the psyllium, which is mostly soluble fiber, and not the bran, which is mostly insoluble fiber, was effective for treating IBS. A potential side effect of fiber supplements is bloating and gas. Therefore, fiber intake should be increased slowly. For more on IBS, herbs, supplements, or natural treatment plans, check out my website.